Good afternoon, or good morning. My name is Evelyn Ho. I am the lead public information officer for the County of Santa Clara Emergency Operations Center. Before Dr. Cody joins us this morning, I would like to read a statement provided by our medical examiner coroner, who was not able to be here in person this morning. The medical examiner coroner has identified 3 individuals who died with COVID-19 in the county before the first COVID-19 death initially known and reported on March 9th, 2020. The medical examiner has a protocol in place in which individuals who died, who exhibited flu-like symptoms prior to death, undergo studies for viral illnesses. Prior to the end of February, COVID-19 tests were not available for these earlier cases. These individuals tested negative for other viruses, but because there was continued suspicion by the medical examiner that these deaths were caused by COVID-19, the medical examiner sent autopsy tissue to the CDC for definitive testing. Yesterday, the medical examiner coroner received the confirmatory test results from the U.S. Center for Disease Control and Prevention for tissue samples from 2 individuals who died on February 6, 2020 and February 17, 2020. The CDC confirmed SARS-CoV-2, or the virus that causes COVID-19, in these tissue samples. Routine postmortem viral testing and autopsies are critical modalities used by our medical examiners in identifying COVID-19. But most importantly, understanding its pathogenesis in the human body. The medical examiner coroner has worked closely with public health on a procedure in which postmortem samples are routinely tested for COVID-19 on current and potential future cases. And now I'd like to invite Dr. Cody up to provide her remarks about these cases as well.
Good morning, everyone. Thank you for adapting to our conditions here at the building. As you know, I'm Dr. Sarah Cody, Health Officer for the County of Santa Clara. And today I wanted to just give a little bit more information. As you know, yesterday we announced that 2 individuals died with COVID-19 in February, and 1 individual died of COVID-19 in early March. All 3 of these cases were before what we had thought was our first death. And I know there's a lot of noise, and if you'd like me to start again, would you like me to start again? Okay, we'll just wait for the the ready refresh water delivery. Those of you on audio, tell me, and I'll just start again whenever you're ready.
Yeah, fine.
Okay. Ready to go again? Maybe they can cut their engine.
Jackhammers were on the other
I know.
side.
This whole response has highlighted the importance of flexibility. Okay. Good morning. I'm Dr. Sarah Cody. I'm the Health Officer for the County of Santa Clara. Thank you all for joining us this morning. As you know, last night we announced 3 deaths from COVID-19 that prior were unknown to us. 2 of these individuals died in early February and 1 died in early March, and all 3 were occurred before what we had thought was our first death on March 9th. I just want to take a moment and really highlight and applaud the work of the medical examiner. I think that the Office of the Medical Examiner, their thoughtfulness and care in really understanding the cause of death for all of the decedents that they take care of is critically important. For us in public health, it helps us better understand the pace of the epidemic. So back in early February, as you may remember, we did know that we had had COVID-19 in our county, but we had not yet identified our first case of community transmission. That didn't happen until February 28th. What these deaths tell us is that we had community transmission, probably to a significant degree, far earlier than we had known. And that indicates that the virus was probably introduced and circulating in our community again far earlier than we had known. I want to switch topics and briefly address another facet of our response to COVID-19, and that is the data that we collect and the data that we share on our website. And I wanted to let you know that later today we will be updating our website and including data by race ethnicity. As you know, race ethnicity data for people who have died of COVID-19 is available on our website. We've been working very, very hard to obtain missing data for all cases and to present it in a way that is meaningful. We still, unfortunately, have a large amount of data that are missing with regards to race ethnicity, but we will present what we have with the caveat that it is not complete data. One of our core areas of work in the public health department before COVID, during COVID, and for time to come is our work on ensuring racial and health equity and understanding the social determinants of health and how they impact our health and our health outcomes. So social determinants of health are things like education, housing, income, employment, language access, etc. And all of those factors, as well as structural factors like structural racism, impact and inform our health and our health outcomes. And what we're seeing across the country is the importance of understanding those social determinants of health and understanding how they can inform our actions to better prevent, control, and mitigate the impact of COVID-19. And so we want to make those data available and public, and we will be doing so later today. And I have time for a few questions.
Dr. Cody, when were these tissue samples collected and then sent to the CDC? I understand Evelyn talked about some of the protocol in place and whatnot, but if you could just kind of break it down for us. And also, are more of these types of investigations in regards to previous deaths going to be occurring, and what does that look like as you look back on those cases?
Thank you for the question. I don't have the exact dates of when the samples were taken, but the process of an autopsy is a lengthy process. It's sort of like an iterative investigation. So the pathologist performing an autopsy might have some findings that they can't quite explain, and then go back and get further testing and then begin filling in the picture. If there's something they still can't explain, then they would go back and get other tests. So I don't have the dates. What I can tell you is that the medical examiner's office and the public health department were working together since the very beginning, because the medical examiner definitely wanted to understand the impact of COVID-19 on what they were seeing in their office. But as you also remember, we didn't have much testing available early on in January and February, and so we couldn't test everyone. And so the medical examiner, I think, had these cases where there was a question whether there may have been an infectious cause, and so they just sort of didn't close the cases and kept samples, and then ultimately got them tested and confirmed COVID-19.
Dr. Cody, if this was spreading in the community as early as February 6th, or even before that, since that's when the folks died, are you surprised that the mortality rate in this county wasn't higher earlier than it was? Is there anything shocking
Right.
about that to you?
I mean, the couple take homes from these findings. In some ways, it was not entirely. I mean, it was somewhat surprising, but not completely, because when we identified our first travel-associated cases in late January, we had a very narrow case definition. We were only looking among people who had traveled, and we had been wondering, how will we detect community transmission if we're not testing people who haven't traveled? And I think this answers the question in that we didn't detect community transmission. What I can say is that we know that each of these deaths, especially since there are 3 of them in February and early March, they're really like iceberg tips. So they're indicators. When you have an outcome like death or ICU, that means that there's some iceberg of cases of unknown size that underlie those iceberg tips. So with 3 of them, that tells us that there must have been, a somewhat significant degree of community transmission. It was really difficult. Remember, we had a robust influenza season, so it would have been extraordinarily difficult to pick out what was influenza and what was COVID-19.
Dr. Cody, a two-part question. How often are you or the public health department in touch with the governor's office about the work that's being done here in Santa Clara County? And secondly, is the CDC still embedded here, and are you or someone from the county in touch with anyone from the National Coronavirus Task Force about what's happening on the ground here in Santa Clara?
Our partners through this response have been the California Department of Public Health, who coordinates with the governor's office, and the Centers for Disease Control and Prevention, because those are our 2 public health touch points. Sadly, we do not have CDC staff embedded with us any longer. They were enormously helpful in both structuring our response and doing the work and being thought partners. Now that the coronavirus has sprung up in every corner of the country, they're needed elsewhere, and so we had to let go. So right now the response is composed of Santa Clara County staff.
The 3 fatalities that we're just learning about, do you know how they got? Were they travel related? Were they community spread? Who were they? What ages, sexes, anything like that?
So the information that I can share about the 3 fatalities, the fatality on February 6th was a 57-year-old woman, on February 17th a 69-year-old man, and on March 6th a 70-year-old man. As far as we understand, none of these cases had a significant travel history. We presume that each of them represent community transmission, and that there was some significant level of virus circulating in our community in early February. Well, probably in late March, and who knows how much earlier.
Dr. Cody, looking ahead to the expiration of the shelter-in-place order, your counterpart in Santa Cruz County has talked about the possibility of easing some of the restrictions in place. Can you shed any light on some of the items being considered? For example, other states are going to allow gyms and salons to reopen if social distancing is allowed. Is that something you're considering, or is that just, or do you view those exceptions to be too risky at this point of the pandemic?
What I can say about the pandemic are a number of things. One is we anticipate that this pandemic is going to be going on for a very, very, very long time. We know that we do not have immunity in the population, nor do we have a vaccine. So any time that we let up on our mitigation measures, we are going to expect to see a spike in cases, hospitalizations, and deaths. That is certain. I think what these 3 deaths tell us is that community transmission had arrived much earlier than we were able to detect it. And I think it really highlights the importance of the shelter in place in protecting the community and preventing hospitalizations and deaths from COVID-19.
We got one more final question for Dr. Cody.
Because of the time lapse from when these cases first, or when these people died, and then when the numbers started going up later, does this make you think that the asymptomatic spread is greater than previously thought?
So we don't know. I mean, we know from other work in other areas of the world that a significant amount of transmission does happen from people who have no symptoms at all or who have very mild symptoms. So that certainly is a significant contributor. But we also know that in January and February, we must have had the virus circulating, but we weren't looking for it. And it probably was, it may have been part of our influenza numbers because it looks a lot like influenza. Really difficult to pick those things apart absent confirmatory testing.
Thank you, Dr. Cody.
Thank you.